Hello, today we're looking at wind stroke in traditional Chinese medicine. Please pause and read this. This is for acupuncture undergraduates only. We'll have a very brief history. We'll look at CVA in Western medicine, which has a very close correlation to wind stroke in Chinese medicine, but isn't the same thing. We'll look at before the stroke and what you can do for prevention, or if somebody's had a stroke, trying to prevent a further one. We'll look at diagnosing the stroke and the acute stage. We'll look at the sequela of stroke and usually what we're doing and how we go about treating that. So wind stroke is defined by sudden hemiplegia, which is paralysis of one side of the body, deviated eyes and mouth, and impeded speech or impeded spirit. So this was first discussed by Zhang Zhongjing way back in the Han Dynasty, and he put it down to external wind and talked about various types which could be from the low into the Jing channels, bowel and organ types gradually getting deeper. In the Song Dynasty they started looking at fire and phlegm and deficiency, things that we're more familiar with. In the Yuan Dynasty it started to be recognised that external and internal wind could be like a true stroke and a pseudo-stroke. Zhu Danxi, one of my heroes, said that first you resolve phlegm and then you nourish and invigorate blood to treat a stroke. And then finally in the Ming Dynasty, some of the terminology that gets used in modern textbooks about organ, tense, flaccid and channel types was talked about. A CVA in Western medicine, cerebrovascular accident, is where part of the brain dies because of lack of blood supply. And in the UK, we're talking about 100,000 strokes a year, a shocking 400 of them childhood, a quarter at a working age, and there are 1.2 million stroke survivors, so fourth biggest cause of disease and the largest cause of disability in the UK. Probably seen the FAST diagnosis, which is said to identify 9 out of 10 strokes, and the FAST stands for face, which is drop mouth or eyelid, or ptosis if you prefer Greek, deviated eyes and mouth in Chinese medicine terms. Arms unable to lift one or both arms, weakness or numbness. This is our hemiplegia. If you're checking this with somebody, get them to close their eyes before they check it, because it's very distressing for them to find out that their arm doesn't work. Speech, which can be slurred or garbled, unable to communicate, confusion. And the T stands for time, so it's time to dial 999, and the quicker you can get somebody into Western medical treatment, the better prognosis. So really important to act speedily if you suspect somebody's had a stroke. Physical are the most common problems with post-stroke survivors. 60+%, unilateral weakness or paralysis, poor coordination and balance, fatigue, apraxia, which is just Greek for non-action, changes to voluntary movements, spasticity or tightening of the muscles, and changes of sensation. Aphasia is also very common, so this is speech problems where the speech is slurred or garbled or poor understanding of speech. Dysphagia, which is difficulty swallowing or coughing and choking when eating, so the swallowing reflex isn't working properly. Psychological problems are common, so depression in between 30 or 50%, depending on where you get your figures from. Anxiety, frustration, emotional lability, so changing from one emotion to another at great speed. A fifth of people. Change to personality and mood can happen when there's damage to the brain. Cognition, so reduced communication skills, reduced spatial awareness, poor memory and concentration, poor problem solving and planning. It can affect vision, so 20% of people's vision affected at 3 months, and that can be blurred vision, dry eyes, or hemaniopia, which is loss of half of the field of vision. So one eye can only sort of see halfway across the field of vision. And there can be bowel, bladder problems, weakness or incontinence. Usually these are short term, but they may be more persistent problems. And the thing I would add to that is that for people that have had a stroke, doing ordinary things is often very tiring. Their brains are retraining. Just going through what would have been everyday things can be extremely exhausting while their brain relearns how to do things. If we look at the risk factors in Western medicine, it can give us some insights in terms of Chinese medicine. So age is the biggest risk factor, being over 65. In Chinese medicine, we think about kidney Jing deficiency, we think about blood stasis, and we think about build-up of damp heat with aging. Smoking obviously leads to phlegm and heat. Obesity also leads to phlegm, or is a build-up of phlegm. Lack of exercise again leads to qi stagnation, but also a build-up of fluids and lymph in the system, which we would think of as being phlegm or damp. Poor diet is a big factor, so we see this in various ways. The Mediterranean diet has a much reduced, I think it's about 50% reduced risk of stroke. Rich fatty foods or overeating leads to phlegm, and excess of salt leads to high blood pressure, which in traditional Chinese medicine terms would usually be kidney yin deficiency and yang rising. Poor diet leads to spleen qi deficiency, generally missing meals and eating too much junk food, and alcohol and heating foods can lead to heat. Stress, family history, alcohol, high blood pressure as we previously mentioned, high cholesterol, which again we would mostly regard as being a condition of phlegm or stagnation. Atrial fibrillation, where the atrium of the heart isn't beating properly, and it's a great place for blood clots to then form, which can cause a stroke. And in Chinese medicine, this often corresponds to heart yang deficiency, blood stagnation, and diabetes, which at the late stage corresponds to a kidney or a spleen deficiency, and usually if it's type 2 diabetes, we're talking about dietary factors. Western medicine, 85% of strokes are ischemic, so this can be caused by an embolism, which is either a clot, atherosclerosis where cholesterol builds up in the blood vessels, or it can be cancer cells or bacteria, air or marrow, but some sort of mass travels to the brain and blocks the blood supply to the brain. It can also be caused by a thrombus, and this is a mass which actually forms in the brain itself. Cholesterol builds up and then a clot forms over the top of the cholesterol is the most likely. Lacuna strokes, where high blood pressure leads to thickening of the cerebral arteries. Watershed strokes, where not enough overall blood reaching the brain, so where you get two blood vessels that are feeding, not enough blood gets through, and so you get a bit in the middle which isn't properly fed and dies off. And also some unknown causes, and this may be that the cause is unknown, or it may be that the investigations aren't done, or they don't actually find the culprit. That leaves 15% which are hemorrhagic, which are caused by a bleed. This can be actually inside the brain or on the surface of the brain. There's also something called a TIA, or a transient ischemic attack. These, you have the same symptoms of a stroke or a mild stroke with dizziness, confusion, usual hemiplegia and the other symptoms. The symptoms go within 24 hours. These are really important to take seriously because they can go on to become a full stroke. So before the stroke, or prevention. So we want to be treating at-risk patients. So this is patients that have had a TIA or a stroke. They're showing all of the precipitating factors, which we'll have a look at in terms of Chinese medicine, or they have a lot of the risk factors that we just talked about in terms of age and some of the other underlying health conditions. It's really important to treat these underlying pathologies, but it's really important to give good lifestyle advice as well, to manage stress, treat with diet, use exercise, do all of those things. 5 things that we look for risk of stroke are wind. So obviously this gives us our sudden attack, spasm and stiffness, and affects the limbs. Phlegm. Wind phlegm gives us our typical stroke symptoms of hemiplegia. Can also see wind phlegm in epilepsy, and we look for things like muzzy head or obstructed thinking. Heat, or essentially fire, very severe heat, which can then stir wind. Blood stagnation. This is usually a secondary problem, but it can be a big part of it, and we look for blood stagnation as a risk factor, and we see blood stagnation in the stroke as pain, rigidity, and also strange illnesses where the Shen becomes obstructed. And finally, deficiency. Deficiency of liver and kidney yin, or of Jing deficiency. Remember, when there's Jing deficiency, we often see a yang deficiency and a yin deficiency going together, and then we get the yang rising. So yin deficiency leads to yang rising leads to wind, and the wind causes the stroke. Also, if the body fluids are deficient, that can lead to phlegm, and if the spleen qi is deficient, that can also lead to phlegm. We look at these in a bit more detail. So internal wind, where we most commonly see it, is yang rising leading to wind in terms of a wind stroke. Extreme heat leading to wind you can see as a wind stroke, but it's more commonly the sort of wind you get in severe infections. And blood deficiency can also lead to wind. This can be a precipitating factor to the yang rising and the wind, or you can see it in TIAs. Why wind? Well, we get sudden attacks, we get unconsciousness perhaps, we get hemiplegia, numbness and tingling, spasm and stiffness. We might also look for a history of migraine. There might be dizziness, blurred vision, poor balance, tremor or tics. Now, the tongue is an excellent way of looking at risk factor with stroke. So for internal wind, we're looking for a tongue that's deviated, stiff or moving. External wind can affect the channels, and this can give just channel problems, and we'll talk about that a bit more later, but things like Bell's palsy might just be purely external wind. So the build-up of phlegm can be a contributing factor in having a stroke, and we can be left with phlegm in the sequela of a stroke. And this phlegm might be dietary, it might be constitutional. Sometimes people just have high cholesterol for no good reason, for example. Smoking is a factor, and obviously spleen deficiency. Phlegm can stagnate and create heat, and heat can stagnate and create wind, but usually you need either heat or wind around to carry the phlegm up into the head. The sort of phlegm that we usually see is called wind phlegm. And if this is superficial, in the lomi we get numbness. If it's deeper in the channels, we get hemiplegia, facial paralysis. Phlegm can also obstruct the heart's orifices. So in a stroke we see this in aphasia and slurred speech. In different contexts we might see this in mental illness. It also may be how the stroke itself affects our thought processes, or even our personality, depending on how deep it is. And we might see symptoms like a muzzy head, disconnected dizziness with phlegm obstruction. We also have qi phlegm, which is a mixture of qi stagnation and phlegm. We see this particularly in the throat, so as a blocked throat or difficulty swallowing, and especially when that's related to the mood. And we may also get good old-fashioned, these are all types of insubstantial phlegm. We might see good old-fashioned substantial phlegm, which is the sort of phlegm you can cough up into your hanky. So we might have a cough, have catarrh, we might see physical signs. In the pulse, slipperiness or wiriness, and we said the tongue is really important, swollen, and there might be a slippery or a sticky coat. Heat, and especially fire, so if heat gets to the point where it becomes fire, then it really has a strong ascending action. So heat can be a precipitating factor, fire can be a cause and something that we watch for in the prevention of a stroke, and this is usually from emotional factors. Can be some dietary factors if diet is very hot or if there's a lot of alcohol, but usually we see this with emotional problems. So fire has a very upward nature, so it gives us symptoms like a headache, bitter taste in the mouth, red eyes, mouth ulcers, ear, nose and throat problems, and feeling hot and flushed and having a red face. It injures the blood in yin, so we might see dryness, thirst, dark urine. It affects the Shen a lot more than heat, so we might get more severe insomnia, mania, rage or agitation. And it can move blood, so we might see this with any sort of bleeding, but especially with heavy periods. In the pulse it will be rapid and full, and the tongue will be red, and there may be a thick yellow tongue coating. Again, blood stagnation can be a precipitating factor, and it can be a problem in the sequela stage of a stroke. And I always remember the symptoms of blood stagnation with purple plums. So we have the purple colour, we have pain, which is fixed, stabbing or bruised, leaking of blood, so purple bleeding with clots, unresponsive to treatment, so stubborn conditions that not responding to normal treatment, and masses that are fixed, and swellings. With the pulse we might see choppiness, and the tongue we'll see purple, so purple colour, purple spots, purple veins under the tongue. In a stroke, this often comes from part yang deficiency leading to the blood stagnation, so we think of reduced cardiac function or atrial fibrillation being a precipitating factor, and it settles in the channels. So in the channels we see rigidity, stiffness, pain, hemiplegia might be a factor, and we see it in the tongue in aphasia, as well as actually seeing it on the tongue. If you like more detail, this is some of the ways that we might see blood stagnation. You can pause and read this if you want to. Finally, deficiency. Kidney and liver yin leads to liver yang rising. So this we see often with high blood pressure, and liver yang rising, if it becomes severe, can create the wind. So this is the most common problem with stroke. And also if the kidney and liver yin's deficient, the body fluids are deficient, and this can lead to thickening of body fluids and phlegm. Now, there's lots of causes for deficiency, but chronic illness, overwork or regular lifestyle, lack of sleep, and excess of sex in males. It might be the after effects of an external attack of heat causing loss of body fluids. We don't see this so much now because we don't have so many long fevers. Might be long-term blood loss. It might be old age, and of course this is a big factor. And liver yang rising might be exacerbated with stress or alcohol. So the other deficiency that we see is spleen qi deficiency, and this obviously leads to a build-up of damp and phlegm. So again, we've got dietary issues, we've got mental strain and overthinking, we've got a overly damp environment or working environment, or living environment, and chronic illness. And the other thing that I've put here, which isn't talked about so much, is liver qi stagnation. But of course, if there's liver qi stagnation, then we're more likely to get a build-up of damp, and that can become phlegm, or we're more likely to get a stagnation of blood. So this can be a factor when there's a lot of stress, and especially frustration and lack of exercise. So the symptoms we see with kidney and liver yin deficiency are the ones that you'd expect: dizziness, tinnitus, vertigo, poor memory, hearing loss if this becomes into the jing, poor vision, dry irritated eyes if it's liver yin, nocturia can be a problem, lassitude, depression, anxiety. Pulse will be floating, empty and rapid, and the tongue will be red, peeled and cracked. With spleen qi deficiency, our usual culprits: weak and tired limbs, poor concentration, empty pulse, pale, swollen, quivering tongue. Of course, we might get loose bowels, poor appetite, all of those typical symptoms. With liver yang rising, we might well see high blood pressure, we might get some visual disturbance. Headaches are very common, migraine type headaches, throbbing, distending head, dizziness, tinnitus, hearing problems, and also feeling worked up, frustrated, angry, outbursts of anger. Now this I've put in deficiency, but of course this is a fullness, but it comes out of here. So here's a simple schematic of the underlying factors involved in a stroke. So we've got deficiency of kidney and liver yin, which might involve the blood. We've got spleen qi deficiency, and there might be full condition of liver qi stagnation, which might be an exacerbating factor. And the yin deficiency leads to liver yang rising, and that can cause wind. We also get the build-up of these pathogenic factors of wind, phlegm, heat, and especially fire, and blood stasis. So there are 5 things that we look for. Thanks for listening.